The CDC's new recommendations bringing tough decisions for local cities and schools. Today we'll hear from Governor Eric Holcomb, Mayor Joe Hogsett, and Marion County Health Director Dr. Virginia Kane. Plus, the Senate reaches a deal on infrastructure, and the House investigates the attacks on the Capitol. It's all ahead this Sunday in Focus. Good morning. State health officials urging Hoosiers to follow the new CDC recommendations on masks as cases continue to rise here in Indiana. But still, for the most part, no new restrictions coming from the state or local governments here in our area as health officials urge people to follow the CDC's new recommendations on masks.
With schools coming back in session at full capacity, I encourage every district to follow these recommendations. These are now local decisions, but the guidance is universal.
All right, that was a briefing Friday. State House reporter Kristen Eskow was there at that briefing, and obviously a lot of talk right now, a lot of questions about this coming school year. Many kids headed back to school either tomorrow or Tuesday.
That's right, Dan, and Governor Holcomb sounded off on this earlier this week, just a couple of days ago. He was telling schools they should do everything possible to make sure kids stay in the classroom this fall.
Parents and school leaders are trying to keep up with the changing COVID guidance from officials.
A little confusing, but you just stay on top of it and listen what's going on.
Interestingly enough, this is the third time we've changed in the last 2 weeks.
Wayne Township Superintendent Jeff Butts says hours after the CDC announcement and the night before school started, he recommended fully vaccinated teachers and students wear a mask. It was already required for those who have not been vaccinated. He says so far, most people are taking the CDC's advice.
In the elementary schools that I visited, I would estimate somewhere around 90% of our staff had them on. Of course, 100% of our children had them on. In the junior highs that I went to, I was probably closer to 80% of our staff.
I would recommend taking every safe step possible, imaginable, doable to keep the kiddos in school.
Governor Eric Holcomb told me this week he doesn't want to see students face any additional learning loss this school year.
There are steps that schools can take, many are, as they go back, they've stated, about distancing, about masking.
Now, Holcomb also says he's most worried about those who are eligible to get vaccinated but don't have any antibodies for protection because they haven't gotten vaccinated and they haven't yet had the virus. And he says he wants to see the FDA give the vaccines full approval as soon as possible to encourage more people to get vaccinated.
I want to see the EUA, the emergency use authorization, turned into permanent. I do hear and I do understand parents, students who are waiting until it becomes permanent. I just spent a few days with about over 20 other governors. And I think to a person, we were all kind of scratching our head as to when will this become permanent. We have millions who have been treated. The trials have been conducted. This needs to become permanent.
And I also asked Governor Holcomb whether he would require the vaccine for state employees, as we've seen in California or New York. He says for now he's leaning against that. But of course, Indiana did pass a law earlier this year that bans state and local governments from requiring or issuing vaccine passports.
Yeah, a lot of recommendations, no requirements at this point. In terms of the full approval for the vaccine, you also heard something very similar this week from Congressman Larry Bucshon.
Yeah, that's right, Dan. He thinks that could eventually end up making a difference in terms of getting more people vaccinated.
How concerned are you, especially as we're seeing the Delta variant really take hold?
Well, I'm concerned in Indiana because the vaccination rate is relatively low. I think nationally it's about 58%. In the Congress, it's over 85%. In certain areas of the country, it's high. So yeah, the Delta variant spreads more rapidly. I don't think it's going to turn out to be more dangerous than the other variants. It just spreads more easily. Let me just say this also, we're trying to get the timeline from the Food and Drug Administration on final approval of these vaccines. They're under an emergency use authorization, as you know, and I think some people are a little nervous about that. They think they're still experimental, which they're not. But I do think formal approval from the FDA, if that can be done, would be helpful.
To get vaccinations up, do you believe private businesses should require the vaccine?
Well, let me just say this. As a government official, I don't think government should require medical therapy. So, I think the private sector, that's their own decision. I'm not going to comment on individual private sector organizations and what they think is right. Government certainly should not be mandating medical procedures of any kind, including vaccinations. What government should be doing is giving all the information to the American people and letting them, along with their physician and their family, make the decision that's right for them.
And a lot of controversy this week in Congress about new mask mandates from the House Speaker. Congressman Bouchon introducing a bill that would provide some nonpartisan oversight for those kinds of decisions in Congress.
Okay, Kristen Eskow, thank you so much. Congressman Bouchon this week also saying he felt the new guidance from the CDC was, quote, disappointing, a backward step in instilling vaccine confidence at a time when we need it to be high. Also, Congressman Andre Carson weighing in saying the spread of the COVID-19 Delta variant is a reminder this pandemic is far from over and that we must stay vigilant, encouraging people to get vaccinated. Well, this week we also spoke with Indianapolis Mayor Joe Hogsett, who says he's still assessing the situation here in Indy. As other big cities move ahead with reinstating mask mandates, Indianapolis has not made that move yet.
We're still just a bit over a 5% positivity rate. And most public health experts will tell you a 5% positivity rate is where you want to be. So I can't say it enough. Get the shot in the arm and you won't have to worry about the Delta variant.
Obviously, some of those numbers have gone up since we spoke with the mayor in terms of our positivity rate. This week, Marion County Health Director Virginia Kane spoke with reporters about the Delta variant and some of the big events now here in our state, like the Indiana State Fair. Bianca Reyes has more.
We could be back where we were before unless this community takes on a greater responsibility of getting more people vaccinated.
The risk of catching COVID-19 continues to ramp up in Marion County, officially being listed on the CDC's website as an area with substantial transmission.
That means we were experiencing, by their criteria, at least 63 cases per 100,000 population on a 7-day average.
Dr. Virginia Kane says that positivity rate is getting even higher, something especially concerning with the state fair just days away.
Generally speaking, we draw in a typical year with the typical fair around 890,000 people over the course of the entire fair.
State fair officials say masks will still be optional for fully vaccinated Hoosiers and strongly encouraged for unvaccinated Hoosiers.
We do have safety measures in place to make sure that the Indiana State Fair is a safe experience for everyone involved.
Those safety measures include cashless payments, vaccination tents, and hand washing stations. But Dr. Kane says she would take things one step further.
I think if there's a large number of folks attending and you think that you can't do the social distancing, I think you need to be masked outdoors.
All right, that was Bianca Reyes reporting. The State Fair, of course, underway this weekend here in Indianapolis. Meantime, in Washington, the U.S. Senate now debating a tentative agreement to fund President Biden's infrastructure spending bill. There's debate on how much that final plan should cost and how the government can afford to pay for it. Some say the $1.2 trillion price tag is too much, while others say it's not enough. Now, this week, I had the chance to speak with Indiana Senator Mike Braun, who voted against moving forward with that current infrastructure deal, despite acknowledging that he agrees with a number of items in that bill.
The problem here is we never look at the underlying issues, like the fact we haven't done a budget in 20 years and that we borrow almost all the money that we spend here. And I like the policy mostly embedded in it, but these are not hard pay-fors. You never run any other entity, government or business, in that fashion.
What does this mean, though, for Indiana's roads and bridges, which obviously could use some infusion from the federal government, no matter what kind of deal comes out of this? Whether you like how it's being paid for, yep, Indiana might still benefit from some of the things that are being discussed in this package.
Number one, Dan, it's going to happen. Okay, so there's not going to. This bill is going to pass.
So this is a protest vote on your end, more or less.
It is, and it has been on most things since I've been here, and I always explain it accordingly, because if someone doesn't do that, our kids and grandkids are going to have not only an inflation bomb, but a debt bomb to deal with.
Senator Todd Young, by the way, did vote to move forward with the debate on that bill. Also in Washington this week, the first hearing of the Select Committee investigating the January 6th attack on the U.S. Capitol.
Democracies are not defined by our bad days. We're defined by how we come back from bad days.
Many more lives might have been lost, and the rioters could have accomplished what they set out to do.
Now, after the hearing, we also heard from Indiana Congressman Jim Banks, who was blocked from serving on that committee by Speaker Nancy Pelosi.
It's clear at this point that Nancy Pelosi has cherry-picked the members to serve on this committee. She's pre-written a narrative. Only members who will stick to her talking points are allowed to serve on this committee.
The committee could hold its next hearing as early as next month. Of course, there's been a lot of talk about our election since the events of January 6th. Congress working on election reform, various states also taking up bills dealing with election law that have already caused some controversy. This week we had a chance to talk with Indiana Secretary of State Holly Sullivan, who says she's not in favor of new legislation here.
Indiana's been a leader in voter access, quite honestly, and something to be very proud of. I always say that, we've had the steady hand on the wheel of our elections process for many years. We've just had a very steady, strong, secure process around our elections in Indiana. We are also one of the first states to be able to increase voter access to registering to vote online several years back. And we continue to look at ways in which we can make it convenient and readily accessible to our voters.
More of that interview on our website and next